Welcome everyone to tonight's webinar on survivorship care of the EU CAIAS-NET project. My name is Katrin Scheinemann. I'm a pediatric oncologist from Switzerland and also the Pancare chair. And together with our partner in this project, CCI Europe, Youth Cancer Europe, and the Medical University of Vienna, we like to welcome you. Before I start, I would also like to introduce my co-hosts, Cherine and Tessa, which are both project managers from Pancare in this, but they also have a few other hats, and we will come to this later in this webinar. And now I will start with the introduction in the topic and would like to have the first slides, please. Please be reminded while we're waiting for the slides, there is a chat function, so please ask all your questions there. And there are many people in the background helping with this. And any important links or resources will be shared with you by the end of this webinar. So the program for today, you can see there will be a quick introduction, then we'll talk about long-term survivorship care, then personal experiences and how to build up and establish this, how to set up a clinic, a lot of like personal interviews, and then hopefully we will end on a good note how the project can contribute to that. These are the cohorts, if you have not seen them on the screen, but you will see them in a few minutes. And now we're coming to the introduction, which are two parts of this. First is Pancare. Many of you hopefully have heard about this. Pancare is a multidisciplinary pan-European network, and it consists of professionals, but also survivors and their families with one goal, working on long-term follow-up care for European childhood cancer survivors. And childhood is like really childhood, adolescent to young adults. And we have, I think, our mission is to ensure equal access to optimal long-term follow-up care and to improve the quality of life for every child and adolescent cancer survivors in Europe, which is a heroic goal, but together we can really achieve this. So what is the role in Pancare in this? And we have a few things we like to really strengthen there. Empower survivors. Clear, that's what we are talking about. How can we do this? We do educational courses, and the next one is already early March, where we try to teach as many healthcare providers, but also patient advocates, how long-term follow-up should look like. We have our annual meetings in the fall on very nice places, so come and join us. We have a plan and a communication group. You may also know Pancare from the many research projects. We have done lots of projects in the past and in the future, really researching and learning about late effects. Survivorship care, a lot is about guidelines, because not everyone should just pick and choose how to do that. We have evidence, and with this we created guidelines. What could you really have to look for depending which chemotherapy or treatment you have received, in what frequency you need to do this. We cannot do this on our own. We need a network. All of you here are part of the networks, but we have our annual meetings, but we have also strong partners, for example, SIOP Europe, which is Pediatric Oncology Society, as well as CCI Europe. We have to spread awareness, because still it's not a given that everyone knows about survivorship care, so that's part of the communication group. We develop methods how to improve this. Research projects I talked about. One important thing is also twinning program. What does this mean? A clinic or a country where we have a relatively well-functioning survivorship care program can help an institution or a country where this is not yet established, or helps them building it up and strengthen it even more. And also to increase visibility. For that, we do our annual meetings, but also have a communication group, and you've all seen our activities in the social media. What does survivorship care means? And you have all seen this graph many, many times. It's the success story of pediatric oncology. looking from a deadly disease after World War II, over the past 50 years, it becomes a highly treatable and curative disease. As you can see there, unfortunately, not for all entities, but for very many of them. So where is the problem, and why do we talk about survivorship care? And you can guess now when this concept was introduced of survivorship care, before I go to my next slide, and potentially many of you will be surprised. Because it was introduced already in 1974 by Giulio D'Angio, who said pediatric cancer in perspective cure is not enough. And I'm still really amazed every single time I'm reading this, because that was at the time where all of this, like really overall survival, I have shown you the slide before, was not for granted. We had only a few survivors, only the ones who more or less were cured by surgery only. But he already said it's a early detection of the delayed consequences of radio and chemotherapy. Careful studies of these late effects must be conducted, and there are several under the way. So he was a visionary and is really responsible for where we are at the moment. What is the current situation, at least for Europe? We have roughly, but no one knows exactly, over 500,000 childhood cancer survivors. But we also know that a lot of them, and with a lot I mean like over a half, but you also can find the number of 2/3, experience some kind of long-term health-related problems. And we also know that the care for these problems differs largely between European countries, which influence this then really the long-term and overall survival. So let it summarize a little bit. What have we achieved with research? Where do we have to go from now? In our days, we can really say it starts at day one of diagnosis, because the active treatment from the beginning already has in mind late effects. And we try to the selection and the better risk adapted treatment really influencing long-term side effects from day number one. It is only possible in the international collaboration. That's something given for pediatric oncology. It's the same for survivorship care. It really has to be evidence-based. We have to do what we need to do, meaning not over or under treating. I think it has to be part of oncological care as the active treatment. We have not done our job if we just stop it on the last day of treatment. It's only possible to research efforts. National cohort studies are a good thing to start because we can follow them over decades, but we have to pool all the data internationally. There are tons of different models, but there is not the one size fits it all. They need to be adapted to the local and national setting. But there are many examples for that, so you don't have to start from scratch. Think about childhood and adolescent cancer survivors becoming adults. We are pediatricians. So at one day there is a transition. We need adult partners, and that's potentially the biggest challenge. But also we need partners outside of the medical care, for example, vocational support. So we have many things achieved, but many things ahead of us. And with this, I would like to hand over for the next part to Cherine and Tessa. Thank you.
Thank you, Katrin. Hi, I'm Cherine.
Hey, I am Tessa. And yeah, thank you, Katrin, for your introduction. So we are your co-hosts, and if you have any questions about the topics or during the presentations, just put them in the Q&A function in the chat, and we, together with Ulrike and Marie, will try to get back to you and answer all your questions. And there will also be a short Q&A section after some presentations, so we can pick out your questions and ask them to the speakers.
But first of all, we'd like to get to know more about you. So we start with our first poll. So in the screen, you see the URL. You can take out your mobile phone, enter the URL, or scan the QR code, and please answer the following question. I attend this webinar as a... Right. Nice distribution.
Yes, I think about half the people have filled it in now. So we'll wait a bit longer maybe. But indeed, we see mostly kayak cancer patients, survivors, or ambassadors, or healthcare professionals.
Yeah, and it's always nice to see different people with different backgrounds.
Yes, and we have really nice agenda today. So there's also different perspectives. So I'm sure there's good information for everyone. Yeah, should we wait just a bit longer?
Yeah.
So everyone can get started on the Slido. Because I still see some people answering the... Okay, I think we can move on to question number 2. So yeah, how would you describe your knowledge or experience with long-term survivorship care? Do you feel like you describe yourself best as an expert, intermediate, full beginner, kind of learning on the job or learning by experience, or maybe none at all yet, which is also fine. It's because we would really like to know how much you already know. Oh wow, it seems to be almost, I mean, maybe not equal, but definitely everyone is here.
Yeah, it actually makes me quite curious what you will answer to the following question. Still see some answers coming in. Right, thank you very much. So for the third question, if you think about long-term survivorship care, what comes to mind? Which words are you thinking about? Please let us know.
Okay, I see 20 people typing, so I'm really curious what is going to pop up. Yeah, quality of life.
Yeah, some interesting words.
Sorry.
No, go ahead, Tessa.
Yeah. Maybe finish up your words. We're not going to be able to read them all, but I'm really happy to see such different perspectives and words coming up. Self-advocacy, also a really nice one. So yeah, I think we'll give the word back to Katrin Scheinemann for our next presentation.
Thank you very much. And it was really interesting to see that the first word was mental health, which we also addressed in one of these webinars before. So it's still a hot topic. So we're moving on to experience with long-term follow-up care. And it's a pleasure to introduce also Jeroen, another member of the Pancare family. He's now a senior project manager. He has started with us in administration. So Jeroen knows many sides from survivorship care. And Jeroen, thanks for joining us. And I'm looking forward to your discussion now.
Thank you,
Hey,
Katrin.
Jeroen.
Hi.
So, Jeroen, maybe we can start by sharing how we know each other.
Yes, thank you, Cherine. Yes. Well, I think we know each other by via our work for Fox. The Fox is the network for adult survivors of childhood cancer in the Netherlands, part of the Dutch Childhood Cancer Association. And I have joined the work group, I think, over 10 years ago, because as a childhood cancer survivor myself, experienced late effects, I was looking for some support and found it hard to find that in the healthcare system at that moment, and that's why I started to work at Fox. And I think you also joined shortly after, if I'm correct.
Yeah, yeah, I think so too. Yeah, and I joined the working group of Fox too because I'm a survivor myself, and it felt good to be surrounded by others who have gone through similar experiences, and also to be able to do something meaningful for other survivors. But maybe you could tell a little bit more about what Fox actually does.
Yes, well, Fox is organizing peer-to-peer contact, so indeed there you can find help and meetings of other survivors, but it's also providing information about late effects and how to find long-term follow-up care. But next to that, of course, there's also a fun part where fun activities such as drinks or other activities will be organized. And a big part is also patient advocacy. So.
Yeah, because Fox actually means voice in Latin. And I think Fox really gives a voice to the needs and preferences of survivors in their life after treatments. So they are heard and better understood. Definitely for those when thinking about diversity and inclusion, do not have the chance to make themselves heard or do not feel seen.
Yes. And I think even today there's still a lot unknown about late effects and long-term follow-up care also within the Netherlands, and a lot of survivors are looking for information. And I think it's very important that survivors are involved in the long-term follow-up care and cooperate with the healthcare professionals to be actively involved in the organization of care and to improve care in general. So.
Yeah, I agree. So, Jeroen, we go way back. What do you think has changed, in your opinion, when thinking about long-term survivorship care?
Well, I think when I came out of treatment, that was over 20 years ago, and there was first some sort of long-term follow-up care a few years after the end of treatment. But I think that was more or less like, okay, how are you feeling now? And you're out of treatment, so hopefully all will be fine. And I think the most important change for me is recognition of the fact that late effects exist. And of course, next to this, that also there's more follow-up on what do you have as a late effect. But I think it started with the recognition that there are late effects, and that also opened up for more research opportunities and more knowledge about late effects. And I think during the years when I was also involved in Fox, I recognized that survivors are much more involved in the research to late effects and in the organization of care, which is very important to me. For example, within Pancare, but also within this project EU KSNet, really a lot of survivors are involved. So more about that in this specific project later. And well, I think in the Netherlands, we now have a very nice long-term follow-up care clinic where you get screening and monitoring of late effects. And well, for me, that already helped a lot to feel recognized and to have better understanding of late effects and what is happening after the disease and treatment and being a survivor.
Yeah. And I think also another important change is that now long-term survivorship care has a more holistic approach, which can significantly impact the quality of life of survivors. Because of course we now have the knowledge, like you said, that occurrence of late effects are not only physical ones, but also psychosocial ones, which can impact your life in various areas. For example, when thinking about your education, finding suitable work, your ability to move or play sports, questions concerning your fertility, the relationship you have with your family, friends, or potential partner.
Yes, yeah, I totally agree, and I think that's why nowadays long-term follow-up care is and should be in a multidisciplinary setting, so that it's not about only medical care, but also other late effects you may experience in daily life, and to how to cope with this in your daily activities. And I think part of this is also the development of personalized care with the help of guidelines and personalized care plans, which makes that the long-term follow-up care is much more tailored to your own needs and to what you actually had as a treatment, but also what you are experiencing as late effects or just as a survivor and what you are facing in daily life.
Yeah, yeah. Yeah, and I also think that international cooperation has greatly intensified over the years, and many important projects and initiatives have aligned. And I also think that the Kaya Cancer Care community of survivors, healthcare professionals, patient organizations, and caregivers has really grown. And I think together we can really have a powerful voice in advocating for our needs, for example, towards policymakers. And I think it's really, inspiring and also motivating to see that working together on various themes which improve the quality of life of survivor actually makes a difference. So,
Yes, and
Jeroen,
John.
what does it mean for you personally that long-term survivorship care has gained so much more recognition and importance also within Europe?
Yes, well, as mentioned before, it's felt like the recognition you felt more recognized with the late effect you have, and you know where to go if you have any late effect coming off or you face issues in life, so you feel more understood. And well, I think also knowing that it is there and knowing there is research and what the research is gave me a lot of insight in what is happening after diagnosis and treatment. And I think that what was happening was backed up by science and recognized, that helped with the understanding and accepting that it is there. And I think that that's an important thing that is important for a lot of survivors, that they know what is going on and what they might experience can be normal.
Yeah, yeah. I can relate to that. For me, that's been the same. It's very important for me to receive that type of recognition and the reassurance that there's expertise in late effects and long-term survivorship care. And I also feel very much supported by being able to visit the clinic I go to. I know that within Europe, not every survivor has the chance to receive this type of care. So I also feel very lucky and privileged in a way that I can go there. Because often I don't really feel understood or adequately helped by my general practitioner. So I now have the ability to reach out to my long-term survivorship care doctor when needed. And furthermore, I also feel that the relationship I have with the healthcare professionals within the clinic is much more equal. So due to their approach, I really feel that they're helping me with many areas in my life, which contributes greatly to the quality of life I'm experiencing, and that I can somewhat direct my own care and therefore have more control over my life. And then that I can also easily integrate my experience with childhood cancer as part of my identity, and in a more healthy way cope with the impact of childhood cancer in my current life.
Yes, I agree. I think it's very important to cope with late effects, and it's really important, and so to improve quality of life of survivors, to be recognized, and to have some place to go when you have the need for long-term follow-up care. So yeah, and I think therefore I'm also really proud and happy to be able to contribute to this as part of Pancare. I think with Pancare we have an international community where we work very hard with so many dedicated survivors, but also healthcare professionals and researchers to improve long-term follow-up care and quality of life for every survivor in Europe.
Yeah. And I think everybody can play a role in this, Whether you're a survivor yourself, a caregiver, a healthcare professional, even a policymaker, you can contribute either big or small with your own lived experiences or your expertise, your own vision, or the will to cooperate with each other. And yeah, I really believe that together we can take steps in the right direction. So, well, let's hear from our next speakers on how to do this.
Thank you, Cherine and Jeroen, for sharing your personal experience and also your views. So we are moving now from survivors to healthcare professionals, how to establish long-term follow-up. And it's a pleasure to introduce Helena van der Paal, who is the past chair of Pancare and is a little bit exotic because she's an adult physician trained in internal medicine and oncology, but does a survivorship care clinic at the Princess Maxima Center in Utrecht. Thanks for joining us, Helena.
Thank you very much, Katrin. I'm very happy that I can be here, and I hope to give an overview of all the knowledge we have. Let me see. If I would really like to start first before I give my talk with a question. Please type in Slido what you think is important, or better to say essential for long-term survivorship care. I see one participant typing, so we have 95 participants on the on the webinar. So 4 typing, great. And you can't make a wrong answer here, right? It's whatever you think is essential. That is my question, basically. I see a lot of different things. One is holistic care, guidelines, good transition, point of contact, multidisciplinary approach, financial coverage. I think these are all very, very relevant points. Psychological support, great. No waiting lists, that's also really good. Guidelines, guideline-based care, person-centered approach, yeah, great. Also, research, yeah. I like it. Still 6 people typing. I will, whatever you type is we will take this with us in our way in the EUCAIAS project. This is very, very interesting. I hope that in my talk I can address a lot of these things. So thank you very much. And then we can go now to the presentation. We're just waiting. Yeah. And now I should have the controls right. So I would like to come back to the mission of the Pancare network, and it is really to ensure equal access to optimal long-term follow-up care and to improve quality of life of every child, adolescent, and I should say young adult in Europe after the cancer treatment. So this is really important, not only for Pancare, but also for the Princess Maxima Center where I work, where we have the National Late Effects Clinic. I'm not going to share you my personal experience here in the Netherlands, but I want to share you what you can do as a healthcare professional survivor, especially together to improve, to help fulfill Pancare this mission. Let me see, can I, how do I forward the slides? Oh, right, thank you. So Katrin touched upon this, survivorship care, why? I think the rationale is clear. 75% of 5-year survivors have a late effect treatment related to treatment. There are a lot of survivors in Europe, and their numbers are growing. The late effects can be really broad. Every organ, can be damaged. There's things like second malignancies, fertility problems, but also growth and development. And please don't forget psychosocial with mental health, education, work, insurance. All these things can be hampered by the treatment. There is, I would say, an international consensus that most of the survivors need lifelong follow-up care, as the majority experience one or more late effects. So the goal of long-term survivorship care is to reduce the burden of late effects among survivors by first prevention. So preventing a disease from happening is the best, of course. But if you cannot prevent it, then early detection and adequate treatment is also very important to improve the quality of life. But especially adult survivors discontinue long-term follow-up care as they leave the pediatric setting. And this is also true for adolescents and AYA cancer survivors, that they are lost in a way in the healthcare system. So my question that I will try to answer today is how to set up a late effects clinic. And unfortunately, it's not a one-size-fits-all store, but there is a lot of knowledge and information available that you can use in your own national, regional setting or in your clinic. So I would say don't reinvent the wheel, but perfect it. Even if you have an ideal situation like in the Netherlands, where we have a good clinic, we can also improve. So how to set up a late effects clinic? You need people, you need healthcare professionals, and not only the pediatric oncologist, but you also need adult care healthcare specialists. You need psychosocial people, you need a lot of people. You also need survivors, and you need policymakers, not only on a national level, but also in the hospital then when they say, yes, we are going to do this. So this is the other thing. You need a facility, you need a clinic, you need health insurance to pay for it. In the Netherlands, it took 20 years before the health insurance started paying for survivorship care. But we got there. And the other thing that's really important is collaboration, not only with different healthcare professionals like a cardiologist, but also within the other stakeholders, together with survivors, with their parents, with their carers, with their families. And then the question is, okay, we all have this, but what to do? So then I would say use the experience there is, and I will tell you a lot about that. Katrin told us about the Pancare network. We have a lot of partners, and we have done in the past years a lot of collaborative research. So that made a lot of information available, and we are still doing research. But I would like to tell you what the current practices are. So we had Pancare SurfUp. That was the first big project of Pancare, and it gave us the collaboration with the International Guideline Harmonization Group. It gave us a lot of information, and it also gave us the standards for models of care. Pancare Live, for instance, gave us the fertility guidelines. And before that, we also had the survivorship passport in another project. And in every project, the Pancare survivorship passport has been improved. So we work together a lot with CCI Europe and SciOp Europe. And I would really like to say all Pancare members and all consortium members, because there's a whole world of people where we work together. And now I would like to tell you a lot about the Pancare follow-up project. The Pancare follow-up project just ended this January 1st. It was a 5-year project funded by the EU to improve empowerment, health and quality of life of all survivors of childhood and adolescent cancer, and to develop all materials necessary for the person-centered, evidence-based survivorship care, the Pancare follow-up care intervention. And Tomáš, who will talk later, will tell you the practicalities of it, how to use this intervention to set up your late effects clinic. As a wrap-up of the project, we have a lot of things, but we also have the replication manual, as we call it. And this is a toolkit that you can use to help you to either improve your follow-up care if you already have a late effects clinic, or to set it up. We had a lot of partners. It was coordinated by my center. And this is how the Pancare follow-up care intervention looked. First, before the clinic and before a visit, a survivor would receive the survivorship questionnaire and a standard treatment summary based on the guidelines. Then there would be the clinic visit, diagnostic test would be done, all sorts of things that were necessary by the guidelines. And then, if necessary, there was consultation with other specialists, like a cardiologist if necessary. And then afterwards, with a telephone call to discuss the results, a survivorship care plan would be finalized and sent to the survivor. And this has the care intervention has been tested in 4 clinics in Europe, and we have included more than 800 people. So this is really great, and we are currently looking into all the results. But before we could do this intervention, we had to develop all the materials. And this is now finalized in the replication manual. And I will tell you what we have there. So we have recommendations for long-term follow-up, and they are evidence-based and risk stratified. And they are the cornerstone of the Pancare follow-up care intervention. There are 41 Pancare follow-up guidelines, and they cover a range of topics, not only, for instance, cardiac surveillance, but also mental health surveillance, psychosocial surveillance, fertility. Every topic you can think of is addressed. We had 16 existing IGHG guidelines, and we developed 25 consensus-based guidelines to make up the whole spectrum. These guidelines are published, and they can already be found on the Pancare website. And after the webinar, we will send you the resources so you can find them as well. The survivorship questionnaire, to really have a person-centered based approach, you have to engage before you do the clinic visit. So we sent out the survivorship questionnaire with self-reported physical and psychosocial outcomes, medical history, family history, questions about health, behavior, and lifestyle, and very important, the needs and preferences of a survivor themselves. So we developed this questionnaire by identifying and comparing existing questionnaires with input from healthcare professionals and survivors in a Delphi method. And in the end, we finalized the survivorship questionnaire. This is also available under the survivorship questionnaire for your own use. For the Pancare follow-up care intervention, we also had to develop the treatment summary and the survivorship care plan template. And the survivorship care plan is content-wise the same as the Pancare survivorship passport. So you can either use, it's not that simple, but you can use it on paper or as a digital tool. And it has general information like where were you treated, when were you treated, but also a treatment summary, health problems, family history, and the most important part, of course, is the personalized guideline-based recommendations for follow-up care. This is also published and available if you want to use it. So in summary, for the care intervention, we have the recommendations for long-term follow-up care, we have the survivorship questionnaire, we have a treatment summary template, and a survivorship care template. What we also developed is educational information, survivorship care information for survivors, and the biggest part was also developing the plain brochures. In another webinar, Tessa may tell you all about these, but these are the plain translation of the Pancare follow-up recommendations. We have survivorship care information for healthcare professionals, and we have some information on person-centered survivorship care. There's also training on person-centered care if you want to move towards more person-centered approach. So this is a little bit about the plain information. This is already published on the Pancare website. You can find them on the homepage of the Pancare website, plain language summaries, where you can find something on bone problems or anything you want to know. It will tell you if you have a risk or not. You can, when you have a treatment summary, find your own relevant plain summaries, and then you would see something like this. In the replication manual, there's also a chapter on future implementation of Pancare follow-up care, or better, care. So there is a really elaborate implementation strategy that you can use with tips and tricks. There are policy recommendations that you can use if you want to talk to your Minister of Health or to your director of your institute. And there's also a chapter on how can survivors and carers advocate for survivorship care. And we have a chapter of experiences and best practices from the 4 clinics that have implemented the care intervention. Of the most important parts, there are also translations available. So, as I said, all materials will be freely available at the Pancare website. Not the whole replication manual is yet available, as it was just finished 2 weeks ago. So we are currently making the website ready to receive the materials, but it will be done within the first 3 months. And then you can use it to cherry pick whatever you want to whatever you want to use. If you only want to use the guidelines or the template, everything is available as a block. And for survivors, it's already very important that the plain summaries are already available. So what we will do next is, of course, a lot of things. We can always improve on what we want, but we do have to work together. So there are currently four projects where we work in the Pancare Surpass project, especially the digital version of the passport is further developed. In the Smart Care project, we develop we help developing a smart card for survivors, not only of childhood, adolescent, and Kaya cancer survivors, but also for adult survivors. And of course, I don't have to tell you anything about the Kaya's project because we are talking about that today. And Jeroen will tell a little bit more. And we just started with the Equal project, which has a focus on quality of life. What Pancare itself will do within the Pancare guideline group is keep the Pancare guidelines up to date. So every year we will update the Pancare guidelines based on the IGHG guidelines or other emerging information. And with that, we will also keep the Pancare plain information up to date, so that on the website we always have up-to-date information for anybody who wants to use it. So, thank you very much. And are there any questions? Or do we still have time for questions, or are we going further?
Thank you very much, Helena. I think for sure we have time for one or two questions. Tessa, Cherine?
Yes, thank you. I currently don't see any questions in the chat yet, but maybe since you brought it up in the beginning as a poll question, what do you think is the essential or the bare minimum for long-term survivorship
I
care?
think it should be available. The bare minimum is availability. So that would be my dream, that that every survivor has a survivorship care, has access to survivorship care. And of course, it can be a Rolls Royce, but even if it's a small Fiat Panda, it's also fine, right? It's availability, I would say.
Thank you, Helena. I think that's a good finishing up your talk. And to move further, we are moving now to a team from the Czech Republic, Aneta Žáčková and Tomáš Kepák. And Aneta, I'm impressed you are doing a master degree in mathematical and statistical methods in economics, something I would have no clue about, to be completely honest. But you're also a patient advocate there and an ambassador for EU CAIAS-net. And Tomáš, I think many of you know you, also a long-standing member of the Pancare family. You set up the first long-term follow-up clinic in Brno, and you will share your experiences now with us. So welcome, and thank you, Tomáš and Aneta.
Thank you very much, dear Katrin, ladies and gentlemen, dear friends. I would like to thank the organizers very much for the opportunity to share with you our Czech experience, Brno experience of building long-term follow-up care. And anyhow, complement all those bright ideas mentioned by you, Katrin, Helena, Jeroen, Cherine, Tessa before. So many other pediatric oncology centers in Europe have followed a similar path as our centers. And I think that this platform, EU CAIAS-net, is an excellent place for sharing experiences and mutual inspiration. Can I move my slide? I'm not sure. Can I control it? No. So can anyone move my slide, please? Yeah, thank you. Thank you. So, so this is University Hospital Brno Children's Hospital, which is one of the two national cancer centers in the Czech Republic, together with the center in Prague. Today, there are approximately 120 patients aged 0 to 18 treated in this hospital with all types of tumors. Moreover, in the last 2 years, we have treated almost 80 Ukraine children, mostly with more serious types of cancer, which is one of the challenging tasks today. The population of cured pediatric oncology patients is thus growing, with nowadays more than 3,000 patients in Brno, of whom more than 1,400 are already adults. And when we started in 1990s, the chance of curing the most common type of childhood cancer, which is acute lymphoblastic leukemia, was only around 20% in the Czech Republic. So today it's 94% in our centers, or our two centers, which is fantastic. It's one of the dreams we had before. But with the increasing number of cured people, as in all other countries and pediatric oncology centers, there is obvious need to address the late effects of treatment. And next slide, please. Yeah, almost 50 years ago, there was a paradigm shift mentioned by you, Katrin, before, and Giulio D'Angio wrote a groundbreaking work called "Cure is Not Enough." The quality of life is there, and it's important to talk about quality of life. And since 2006, we a wonderful and unique network, which is called Pancare group of collaborators across Europe has been gradually formed to help improve the quality of life of our patients, which is fantastic news. I want to mention that childhood cancers are rare diseases, and this is sometimes producing some troubles. A general problem, and I think it's not only in the Czech Republic, is often the lack of awareness of the issue of late effects and follow-up care. And you mentioned it before as well. And Pancare and EU CHIAS.net is an important platform for me and for the others to gain new information through research, but also through supporting projects. Next slide, please. Thanks to this European network, we have learned a lot from our Viennese colleagues, and some of them are here. And thank you very much, dear friends. More than a decade ago, after a workshop organized by Anita and her colleagues in Vienna, our patients were able to establish their organization, which is called Together to Smile. It's association, which is an important partner for us, health professionals, in formulating the evolving needs of cured patients and in navigating our work. Next slide, please. And as you can see on this slide, these are mostly young, very enthusiastic people, full of energy, with many successful projects behind them. And I'm really proud to be their collaborator. Next slide. So together, we have managed to involve the Brno Children's Oncology Center in European networks and projects. The very first president of the association, Zuzana Vimerova, a psychology student you see in this picture, unfortunately left us a few years ago due to a late relapse of her sarcoma, but her ideas live on in ongoing projects focused on awareness, self-help activities, and mental health. The symbol of this association, a half green and half dead tree, you can see on the logo on the right side of this slide, symbolizes the help of the strong, who are usually cured people, and the weak, who are usually people on the active treatment. And the University Hospital Brno is also a member of European Research Networks for Pediatric Oncology. The new treatments we use today are often associated with the hope of less toxicity of treatment, but it might not be the truth, because with immunotherapies, new so-called cell therapies, the new targeted drugs, for example, the truth is that the late effects are often unknown. Therefore, it's important for everyone to participate in international and national research and to enable other pediatric oncology centers, especially in poorer parts of Europe, to do so. For us in Brno, middle-sized country, quite privileged as well, our involvement in European projects has greatly strengthened our negotiation position at local and regional level, and you mentioned it before. It really helped us to gradually secure the necessary resources to provide good clinical care, but it's an ongoing process. Many of the projects that help us, for example, in the area of obesity, prevention, nutritional counseling, are not covered by public healthcare insurance in the Czech Republic. And I'm happy to hear that it took 2 decades in the Netherlands to achieve coverage. So this is an important message for us as well, which is why the Children's Oncology Foundation and Brno municipality, for example, other dedicated donors are important partners for us. Next slide, please. While follow-up care for pediatric patients is generally very well organized in the Czech Republic, it's until the age of 18 or 19. The problem in the Czech Republic has been the poorly managed process of transition to adult medicine, transition of care. At this point, many of our patients were completely lost to follow-up and often receive no information about their risks and specific preventive measures. Therefore, 8 years ago, we took the opportunity to set up a new outpatient clinic for adult cured patients at the second university hospital in Brno called St. Anne's, when we now follow up more than 800 childhood and adolescent cancer survivors. And as you can see here in the beginning, we had one completely empty room. But today, thanks to the support of our hospital as well as foundations and donators, we have a small multidisciplinary clinical team with 3 nurses, 3 doctors, and nutritionists and psychologists. Our outpatient clinic nowadays is open 4 days a week, 2 days for the pediatric oncologist, 2 days psychologists and nutritionists. We have multidisciplinary sessions, which is a fantastic step forward for us. Next slide, please. But in addition to clinical care, our small team is also dedicated to develop strategies on national level and also educational materials. And a year and a half ago, the very first systematic national cancer plan of the Czech Republic was adopted, and we managed to include the need for accurate care for cured pediatric cancer patients there, which is not an easy task because the number of cured patients with adult cancers is also increasing, and the capacity of medical oncologists is not sufficient to provide follow-up care. So part of the strategy is to decentralize care and provide follow-up care by GPs, general practitioners in the Czech Republic, which is not obviously as good for at least part of childhood cancer survivors. And you also mentioned it before, so some of them are not sufficiently informed. You, Cherine, mentioned it during your presentation and witnesses. So they lack to be informed enough about the needs of young cured patients, and our cured patients are not sufficiently understood. Next slide, please. Therefore, we strive to provide as many informational resources as possible for the entire community in need, both for the cured patients and for the helping professionals, family members. An important platform that we refer to in our Czech documents is the IGAG group. The IGAG, as you mentioned before, provides information on different types of outcomes of care and their management based on evidence-based medicine. You can find a lot of useful information there. Next slide, please. And another important source of information is the treatment summary and the resulting recommendations for surveillance of late effects of treatment. In this slide, you can see Czech version of the treatment summary with the template for satisfied patient, which is there written in Czech language. And you can see the logo of Pancare follow-up project there because it's a dissemination of Pancare follow-up project. Next slide, please. So sometimes building a long-term follow-up care program, and especially it's the truth for Brno, is a challenging and long-term process. A number of previously treated people in particular still do not have their treatment summaries available for dissemination or for digitalization, because hospital information systems do not have this information in parametric structure that they could provide us with. Digging or tracking down data in archives is sometimes detective work and can take several hours to get the information we need for a single patient. Next slide, please. And we are very encouraged by the support of our European colleagues. So you can see here Professor Jacqueline Lunen from Radboud University in Nijmegen, Netherlands, who gave an invited speech on person-centered care in Brno in 2022, which was very well received at the Brno Cancer Days and encouraged us to be patient in building follow-up care. Some things like lacking IT infrastructure or changing mindset of healthcare providers take a very long time, even decades. And you, Helena, mentioned it also before. Next slide, please. And as a part of education of GPs, but also other specialist cardiologists, the first national textbook on the care of cured cancer patients was published in the Czech Republic last year with a 10 pages chapter on late sequelae and their management in pediatric patients. It includes a treatment summary template and survivor care plan according to the Pancare follow-up model. Next slide, please. EU CAIAS-NET is an opportunity for the Cure Together to Smile Patients Association to integrate more among its European partners. And as far as I know, from the current head of the association, the official application to the CCI has already been submitted, which will be another step forward for our community. For me, one of the most important projects of Pancare and EU CAIAS-NET is the creation of plain language summaries, which will help us a lot in transferring the necessary information to the cured patients. And I'm already looking forward to the Czech version. I think the sustainability of this information will be very important, which is a common task for European Commission and for all of us, including all participants of this webinar, I'm sure. And next slide, the final one. Also mentioned before, EU Smart Card and our local implementation. So I again firmly believe that this project will help us in Brno, but certainly all others, because the prototype is being created this year, and different functionalities can help us to transfer knowledge, resources, and to support pro-healthy behavior, healthy lifestyle, for example, to have a chance how to share information in those systems with lack of sharing information across hospital settings. So I'm sure this will help us. And if any one of the participants of this webinar would like to help us with this project, it would be great, and it's open. And if you are interested. And next one. Thank you very much for your attention.
Thank you very much, Tomáš, for sharing this practical experience. Let's bring Aneta in, and we're doing it a little bit more interactive because you are going to interview her. Welcome, Aneta.
Hello, thank you very much.
Thank you, Aneta, to join this webinar and help me with that. And we heard that you are a mathematician, so it will be really pleasure to hear your answers. And it's not prepared, so I have 4 questions for you. The very first one is: could you please tell me and us all your experience with kayak cancer and how we know each other?
Sure. I was diagnosed when I was 17 with Hodgkin's lymphoma, and the whole process of diagnosis was really quick. I started chemotherapy 3 months after experiencing some initial symptoms, and I got my treatment in the Children's Hospital in Brno. And when I finished my treatment, I was already 18 years old. And initially, I continued my checkups at the hospital where I received treatment. However, after 2 years, thanks to our national patient organization that you already mentioned multiple times, I learned about the long-term follow-up clinic, and I transitioned there. And since then, I know Dr. Kepák.
And what, in your perception, what are the main differences for you before and after receiving this, let's say, 2 types of long-term survivorship care? Are there any differences?
Yeah, for sure. I have to say that before the establishment of this long-term follow-up care, I often felt uncertain and uninformed about like what was happening with my health and why. Yeah, so the main point or the main aspect was being informed. I was actually part of the project that was already presented called Pancare follow-up project. And thanks to that, I really do have a personalized plan of my long-term follow-up care. From my experience, it might be really stressful to go to the checkups, even after a long time after the treatment. But thanks to the personalized plan, I feel like I have some control over it. I know exactly which specialist I will see during the checkup. I understand the purpose behind each appointment. And it helped me a lot with this like stress or anxiety that I can have.
Yeah,
So,
that's fantastic to hear.
I mean, this is really for me the main difference.
Yeah, thank you very much for that. What kind of role do you have as a patient advocate in shaping our long-term survivorship care clinic?
I have to say, when the clinic was created, I was still undergoing treatment. So personally, I didn't have the power to shape this care at the beginning. But with that being said, I am now the patient advocate under our patient organization. And this organization was created with a vision to be the voice of cancer survivors, to really present and talk about needs that we have, and also be a connection between cancer survivors and the clinic. I myself, I'm the example of that because I discovered the clinic thanks to the organization. So yeah, the organization and our work is really closely connected to the clinic. Nowadays, we also participate in research studies and also assist with financing the clinic's operation. I have a slide in the presentation maybe where there are photos from a charity event that we organized.
Yeah, if Cherine, please, can you show the next slide for Aneta?
Perfect. Thank you very much. Yeah, so those pictures are from a charity event that we organized last year. It was in collaboration with a brand called Coffee. They are having coffee tracks around the Czech Republic. And our organization had the opportunity to raise money with them. And it was money specifically for the follow-up care clinic. So yes, we are, as patient advocates, I think, part of the process, and it is also one of the key elements of our work.
Thank you very much for this and for your lovely pictures placed here. Is there anything you learn in the process? And you mentioned many stuff before, but let's say what you would like to share with the others, and you also closely collaborate internationally. So may we in Brno be, let's say, a good example for the others? Can we offer something to other centers? What do you think, Aneta?
I think what's important for me was the acceptance, or accepting the fact that after the treatment, it's not over. And a lot of things was already mentioned about long-term side effects and everything. And I think that our clinic that I'm now part of, the long-term follow-up clinic, have really amazing people there. Like you, for example, Dr. Kepák doesn't even know that, but I call him my guardian angel. But all the nurses and everybody there, it is really a place where I feel safe. Not only that I'm taken care of, but my mental health is considered as well. It was also mentioned at the beginning that it is very important for a lot of people. So I think that is really important to mention. And yeah, I very much appreciate the personalized care, all the information that I have. And maybe like the main message I would like to say is that knowledge is power. So I think that being informed and having control over your follow-up care is the most important, at least from my experience.
Thank you very much.
Thank you.
So the floor is back to the organizers now.
Thank you, Aneta and Tomáš. Tessa and Cherine, do we have any questions from the audience?
Yes, Katrin, for Aneta, I have a question for you. What does it personally mean to you being involved in patient advocacy?
For me, it's really, I think there is one like motto that is used in EUKAIAS.net, which is nothing about us without us. And for me, like being able to have this voice for other cancer survivors or for other patients that are on ongoing treatment now is really like the most important thing now, and it's my priority. So I'm really grateful that I'm able to do that. So yeah.
I can imagine. Thank you.
I also see a question about the financing. So I don't know, both of you can answer if you feel like you can add something to it. But yeah, how is the survivorship care consultation financed? Like who pays for it? Is there a system with the insurances?
I can start. It's free of charge. The very basic fact is free of charge and covered by healthcare insurance. But we are lacking good codes for coding this effort of health insurance companies have different codes, which means different money, and it covers, let's say, 10-15 minutes of physicians' time. We need more, so we need extra codes, and we are working on that, but it's a long-lasting process. Once we have these codes, we can open the team to other people like internists, cardiologists, specialists. We can have more solid ground for care delivery, but it's covered by healthcare. Luckily, healthcare insurance.
Thank you.
And just one final question, Katrin, if you will allow it. There's a question about how the patient advocate group was established. Maybe one of you can answer that question.
Sorry, one more time, please.
How the patient advocate group, how it was established?
Our advocate group is under the patient organization, Together Towards the Smile. It's where it all started and when it's still now going. So we try to collaborate there.
Thank you.
Good. Thank you very much, Aneta and Tomáš. So we are moving on. The topic we're now going through is equal access to effective and appropriate long-term follow-up care. How can the EUKAIAS.net project, for this we are here tonight, contribute with this? And it goes back to Jeroen. Jeroen, please.
Thank you, Katrin. Yes, I will now go a bit deeper into the EUKAIAS.net project. We just heard some very nice stories from Tomáš, Helena, and Aneta about their experiences with long-term follow-up care and setting up long-term follow-up care with previous projects and previous experiences. So I will now go a bit further into what EUKAIAS.net will contribute to this, and to achieve better access to long-term follow-up care for all European survivors. Well, first of all, in short, what is EU CAIASnet about? EU CAIASnet is a European project with the aim to map the existing resources that are helpful to young cancer patients, survivors, and their caregivers, and to create European guidelines and empower cancer survivors to advocate for their rights and needs. And this project is divided in several work packages, and for late effects and long-term follow-up care, we focus on the work package 3 about quality of life, and we as Pancare are especially involved in late effects and long-term follow-up care. And next, please. So within this task, there are various activities. These are e-learning modules. These will be developed, giving more information about late effects and long-term follow-up care. Furthermore, we will have some workshops going deeper into barriers and facilitators in setting up long-term follow-up care. We will develop recommendations for care. We have organized peer visits. Sorry. So with the peer visits, we aim to gain deeper insight in the organization of care in different clinics across Europe. These were organized in the Princess Maxima Center in Utrecht, in the hospitals San Juan de Deu in Barcelona, and at the Medical University of Vienna. Furthermore, we will develop the plain language brochures Helena already introduced further. We will create a roadmap, and we will have a survey to identify the best practices and lack of long-term follow-up care. This survey is currently still open until tomorrow. So you will find this on the Beat Cancer website, and this survey will help us to gain more insight in how long-term follow-up care is organized across the different countries in Europe. And with all these activities, we will create a European map with more information of the current situation of long-term follow-up care. So we get a nice overview of how the long-term follow-up care is organized all in Europe, and where you can go to if you have any questions in your specific country. Next, please. So Helena already introduced the plain language brochures. These were developed in Pancare follow-up, and in short, again, the plain language brochures are translations of recommendations on long-term follow-up care and about late effects. And the translations means not that they are translated into the various languages, but that they are translated in person-centered lay language, accessible and international and navigable. So they are easy to use for survivors, but also for non-specialist healthcare providers that are not into the topic of survivors and late effects or long-term follow-up care. And it gives not only survivors access to more information about late effects, but you can also bring this information to other healthcare providers. For example, your general practitioner, if you have any questions or are not connected to a long-term follow-up care clinic, you can bring this information easily to your general practitioner to give them also more information about your needs for long-term follow-up care. And within EU CAIASnet, we will further improve these plain language brochures. Currently, it is mostly plain text, but we will create graphics and animations with further explanations of the late effects that each brochure is talking about. And we'll also give better explanations of the guidelines for long-term follow-up care, but also of certain words that might be difficult to read. And the aim of these plain language brochures is to empower survivors by providing knowledge about the needs for long-term follow-up care. And next, please. Okay. So in short, one of the main outcomes of the EU CAIASnet project for the work package on late effects and long-term follow-up care will be a roadmap. And for this roadmap, we will combine all the work done in EU CAIASnet. So these are the workshops, the surveys, and the peer visits, combine it with existing knowledge from guidelines, earlier developed plain language materials, but also experiences from the network and also previous projects that Tomáš and Helena already introduced as Pancare Follow-up, Pancare Live, and Pancare Surpass in a roadmap with information on how to implement long-term follow-up care across Europe so that it can be adapted to your own specific needs of the country you are in and you are wanting to attend long-term follow-up care. So this will be the main aim of EU CAIASnet, to improve access to long-term follow-up care for all survivors across Europe. So next, please. So thank you.
Thank you, Jeroen, for the nice overview. So we're coming to an end, but we should still use the expertise here around the table for a last question. So what would be your final advice how to organize survivorship care? Let's start with Helena.
Oh, I have to unmute myself, of course. Well, I would say that if you want to start, please start and don't give up, and use the information that there is. We and the experience, and I think everybody within the Pancare network and outside the network in the CCI Europe networks and the EU CAIAS network are very happy to help and give tips and tricks. And that's what we also will do. We will build this European roadmap on the Pancare website.
Thank you, Helena. Tomáš.
Yeah, same. Never give up. It's important. We try to be positive. Sometimes it's difficult, but we try to focus on positive aspects of survivorship. And I saw so many people who really had existential experience in the past, who are so positive, and we learn from all those unique people coming to our outpatient clinic. So for me, it's important to maintain the positive spirit of the team, and teamwork is the base. And the holistic approach mentioned in one of the slides, that's the way we try to go. We can name it holistic approach or person-centered approach is the same. So it's not so important how we name it in different languages. It's important to understand how important is that the cured patient, either on the treatment or 40 years after the treatment, is the partner. And for us, everyone is partners, starting with toddlers, school children, and ending up with 60 years old people coming to our experience, because everyone is unique and everyone is equal.
Thank you very much, Tomáš. Aneta.
I think I have nothing more to add. I think everything was said perfectly, and I really enjoyed this webinar myself. So thank you for all the work you are doing.
Thank you, Aneta. Cherine.
Yes, I'd like to say for survivors who are participating today, please take good care of yourself and try to make yourself heard. So please don't be afraid to ask for what you need or ask help. By, for example, reaching out to a patient organization who can help you get into contact with other survivors. And if you want to use your own lived experience to help other survivors, please know your views are always appreciated and valuable. And patient advocacy might sound as a big thing, but sometimes changes start very small. So you as a survivor having a conversation with your survivorship care doctor about what you're missing in the care you receive right now, or what you would like to improve, so your quality of life also improves, can change many things. So please do so.
Thank you, Cherine. Jeroen.
Yes, thank you. Yes, I think I can agree what was said before, but I can add that I think it's very important to keep collaborating with each other as survivors and healthcare professionals. I think that's one of the huge strengths of the Pancare network, that we have such a great collaboration between survivors, healthcare professionals, and researchers. I think we need all of each other to get forward and build better long-term follow-up care for everyone. So,
Thank you, Jeroen. Tessa.
Well, I wasn't a speaker today, but I can only.
But a host, that's
wholeheartedly-
as important.
Yeah, I can only agree. I think what Jeroen said, talking to each other, asking for help, collaborating together, because no single person can achieve such a huge thing. So definitely working together.
Thank you, Tessa. So I hope you can all take out this positive spirit from tonight's webinar, and we can always have a dream. So let's hope maybe in 10 or 15 years from now, we don't have to talk about inequalities within Europe with the access to survivorship care, so that it is a given. So thank you all speakers and co-hosts for like a really inspiring webinar. Also a special thank you to the people behind the scenes tonight. So I can see Mary and Uli and Asta, because they are as equally important as the one like really being on the screen. Thank you for all the attendees. I hope you got something out of it. Please join us next time. So the topic in February will be transition of pediatric to adult care, and then in March on fertility and sexuality. Now, please enjoy your evening and take good care of yourself. Thank you very much and see you soon.